The ongoing rains are good for farmers, but without observing hygiene and sanitation guidelines, waterborne diseases might emerge. The Minister of State for Health, Dr. Joyce Moriku, says floods can be habitats of germs that cause cholera, bilharzias, and typhoid. State Minister for Primary Health Care Dr. Joyce Moriku Kaducu says government has played its role in eradicating malaria.
We encourage the communities to slash bushes around our homes and to keep the compound grass short. Always wash fruits and vegetables thoroughly with clean water before eating. Avoid eating cold food and drinking fluids packed in used plastic bottles.
She says vaccines have been availed to handle any emerging infections as a result of floods. Recent research findings indicate a decline of diarrhea infections across the country due to provided vaccines. Kaducu says, even though government has worked tirelessly to boost health services in the country, there are 12 districts that are still affected by these infectious diseases.
We therefore call upon the local leaders in these districts to prepare the population so that we can give the second dose of the oral cholera vaccines for these persons in those respective districts. Or we are requesting the public to call our toll-free line, which is 0800-100-066.
She requests local government leaders to sensitize and create awareness about hand washing, keeping homes clean, and avoiding self-medication.
And adhere to our policy of test, treat, and track policy guidelines. We're calling upon our communities to collect water for household use from National Water and Sewage Corporation taps and to avoid water from wells or springs because they may be contaminated with diseases that can cause problems.
Assistant Commissioner in charge of Health Services at the Ministry, Dr. Godfrey Bwire said there is an exercise to vaccinate residents of 12 districts against cholera.
We encourage you pass this message over to those communities living in districts, mainly, these are mainly along the water bodies and along the country border. When we focus on those districts, we remove the organisms which would be available for the other districts. That is why, like this vaccination which we are going to do, which government has already done, after we are reaching the end of this vaccination, we have imported additional 1 million doses.
I'm Ivan Juko, reporting for UBC here in Kampala.